Welcome, everyone. This is Bill Rayburn with Medical Consulting Group, and we appreciate you coming today, and appreciate special shout out to Dr. Karen Perry for helping put the program together today on HIPAA, and as well Link Wilson. So thank you, CompuLink, for allowing us to put this program together. We're going to spend about 30 to 45 minutes with you today and go through what we call HIPAA 101. Again, just so you know who's on the line, my name is Bill Rayburn. I'm the Managing Principal here at Medical Consulting Group, and we've also got Mark Haskellson, who is the CEO of the Compliancy Group. Just so everybody knows, our two organizations work hand in hand in implementing HIPAA compliance programs and practices and the ASCs around the United States. We've had the pleasure to work together for a number of years now and work with practices, as I mentioned, all over the country. One of the things that we want to make sure that we do today is most of you will see an area where you can chat and ask questions, and we hope that you will do that at the end of the program. We'll take questions and answer those, and then if you want additional information, we'll show you how to obtain that information. Again, the Compliancy Group is one of the leading groups in the country with outstanding software. We have been in the eye care specialty area, working with ophthalmology and optometry for almost 29 years now. And as you can see from this information, we have really developed our HIPAA compliance program as a result of a lot of services that we have provided to the eye care industry, again, both in optometry and ophthalmology around the country. With that being said, I'd like to jump right into the program today. And again, we estimate the program to be 30 to 45 minutes. And then we hope you'll stick around to ask some questions. And if you need additional information, we'll make that available to you as well. Again, I'd like to introduce Mark, and Mark, ask you to kind of take it from here.
Great, Bill. Thank you so much, and thank you so much to CompuLink and all the folks that are joining us today. I will do my best to make this interesting and dynamic with real-world examples and practical things that you need to understand. What you'll find, and by the way, we are very excited about our relationship and the great things we've done together with MCG. In the end, we are like a tracking tool. We're like QuickBooks. So we're the tool to help you manage this stuff on a day-to-day basis. We are not, although we are very proud of our relationship with eye care. We're the endorsed solution by many of the organizations, but there's about 40 different medical specialties across the country that endorse our technology to help folks like MCG deliver great compliance tools to organizations like yours. Okay, so let's start off with, most people that I talk to think that HIPAA compliance is this ugly law. It's annoying. It's a pain in the rear, and I got to do it. But part of what I want to stress today is that there's a carrot and a stick relationship for you with your patients. Okay. And in the end, the reason being is, if you think about it, your brand as an organization, what your patients think about you, what your patient think about HIPAA, it can often not necessarily be what you expect. Okay. So it starts off with things like, the average patient, although I'm going to call them a consumer now, because in today's world, especially in ophthalmology and optometry, you are far more of a retail brand than a cardiologist. Okay, so what happens is the average person, before they do business with you, before they go to you, and even after they're working with you, are very quick to go online, look at what are the reviews that are showing up about you. Do you have a presence on the web? Are there comments? And it's kind of interesting that even people who are happy with their current providers will still go looking for information. All right, and it's kind of like a reinsurance. And there's also other statistics around how many people look at, even though they, you would think in traditionally was you'd ask a neighbor, a friend, someone you trust. More and more what we're seeing is the statistics are saying that people are going to the web for their information about their medical services. Now, how do patients feel about HIPAA? Although I would truly say, actually, most organizations often have lots of misunderstandings. That's what we're going to talk about today. But separate of the misunderstandings that we have about what compliance requires, understand your patients, after what they see on the news, they are concerned. And why, or some of the statistics that come back on that is 53% of the people that have had true identity theft believe it originated through an error or a breach or a security weakness within their medical community. Okay, they believe it came from their doctor. Okay, this wasn't someone stole something out of their mailbox. So although they may not understand all the issues and what HIPAA is, often they think it's just that use and disclosure document I signed when I walked in. But no, they are concerned about it, and we'll talk a little bit more about kind of how we see that. So if we were all in a big room here, I'd ask you to raise your hands for this set of questions, but we're going to start off with what is a little bit of some of the misunderstandings we see. And very common when I'm talking to doctors, when I ask, are you HIPAA compliant, the first thing they're going to say is, we have done a security risk assessment. Okay, whether it was done, how it was done, who did it, but there is this. We made the effort to have an some external body look at our security protocols. Therefore, we think we're compliant. Okay. The next things I hear people say is, we have policies, procedures, and manuals. Whether you got them from a lawyer, whether you got them from a trade association, how you built them yourself, great. Most people will say, I am now compliant. I have policies and procedures. Maybe I have a staff meeting, which is where we come to the next thing is training. So often people will say, yes, once a quarter, once a year, whatever is your thing. Maybe we did a staff training on HIPAA compliance. Maybe we brought in an external group. Maybe we're using an online piece of technology. So the question is, after you've done all this, do you think you're HIPAA compliant? And the answer is no. If these are the three things you're doing, you are not HIPAA compliant, and it's one of the reasons why we see the failure rate, the most recent statistics. For years, it was said that it was a 70% or higher failure rate. Okay. Now what we're hearing is that it is as much as 94% of the organizations that are audited fail. Okay. So, by the way, I just want to check. There was a question posted that some people are not getting audio. Can you just give me a confirmation? Someone give me a yay or nay if they're getting good audio, if there's any, the quality is good for them. And you can put it in the question section, which is on that right-hand side. Yes. Okay, great. Thank you, folks. I'm going to keep going. Whoever's the one person who's having a problem, try logging back in again. Okay, so to give you some examples of real world, and this is where I'm going to try to do most of this presentation today, we're going to use, and the first one I bring up is this a nonprofit out of Alaska. So this is kind of the end of the earth here, folks. This is not a metropolitan center. This nonprofit, it's a mental health group. There's only about 30 employees. The problem they had was what's called a malware. So whether it was ransomware or an email virus, because that happened, I'll explain more of the rules about when you have to report and what you do and do not have to report. But in this case, they were mandated to report. They had a meaningful breach, is the term for it. The reason they were fined, okay, in this case, the fine was actually low. The average fine is about $1.5 million. Okay, this one at $150,000 was actually low and had a corrective action plan. That means the government's going to keep coming back and checking on you every 3 to 6 months for a period of time, usually 2 to 3 years, to make sure you fixed everything. Now, why did they get fined? It wasn't for the malware. That could happen to anybody. It was when they asked them to provide what was their the efforts they had made, the good faith effort they had made to be HIPAA compliant. The problem they had was they had done a security risk assessment, but there's actually 6 required audits. So they missed a bunch of the audits. Then as far as their policies and procedures, they were store-bought, which is not a bad thing. But those policies and procedures were never properly modified to address the way they ran their practice. The last thing was they had an external training group come in, which is normally fantastic. The problem was this particular organization had a 30 to 40% turnover of employees. So that once a year training was considered ineffective. right? And I'm going to talk about what is a good faith effort and what's an effective compliance program as we get deeper into this. Okay, so let's take just kind of like, some of the basics to, so as I use terminology in this webinar, we don't confuse anybody. A covered entity is most of the people on this phone call. It is somebody who is involved with payment or treatment or operations in regards to healthcare. So doctor's offices are given. Insurance companies, because they are involved with paying you, okay, are payment. Now, business associates are the vendors who serve you. Okay, that can be a billing company, not to be confused. That can be a clearinghouse. That can be a vendor like a CompuLink. That can be an IT provider. That can be your lawyer. Could be your accountant. It depends what they're doing for you. It is somebody who's doing some service for your organization where there is the potential that they are involved with PHI, protected health information. Okay, or personal health information. I've used it. That term can be used a lot of different ways. Subcontractor just means, hey, you're responsible if you use somebody else to help you do something. You're responsible for their efforts. But let's keep going, kind of a little deeper into this. Now, what is PHI? A lot of people get the basics of PHI: names, addresses, fax numbers, social security numbers. The problem is, often people misunderstand things like account numbers. Okay, serial numbers, URLs even, okay, are, even a picture of, this happened very often, I see, especially with ophthalmological surgery. You took a picture of someone's eye to show something, but if you didn't zero in and there was, let's say, parts of their face on it, that is considered identifiable. Okay, so anything that could be in some way used to identify this patient back to some medical condition is considered PHI. So it must be protected. By the way, things that require protection are things like use and disclosure documents. If the patient said you could, use their information that way, then that's okay, but you need to have a document like that in writing somewhere. And I'll talk more about how it works. Next big misunderstanding we see is security versus compliance. Okay, so doing a security risk assessment is fantastic. Oops, sorry, my screen jumped there a little bit ahead. Sorry about that. But what happens is being secure is fantastic, but you really can't be secure unless you're also compliant, nor can you be compliant without being secure. So it's very important that you combine what is the technology that you're working with in your practice, as well as what is the human side of it, which is much more of what compliance is about. Okay, so I'll come back to this more as I go through the law, but in order to be compliant, you have to, the nature of what HIPAA law said is, we want you to assess your risks, those are the audits, and it's going to be administrative privacy and security, not just security. Then we want you to identify those risks, have written remediation plans. Okay, so we understand here's a broken area, and here's our plan to fix it. Some of that fixing is going to be security related. Okay, and that can be technology like firewalls, okay, or that can be something like locks on the doors. But about 80% of compliance is going to revolve around policies, procedures, and training of your staff. Why? 76% of the security breaches that occur in the world it was basically a human error that caused it. It had very little to do with the technology. It had to do with the mistakes that someone made, failing to do something, failing to follow a policy or procedure, or not having a correct policy and procedure in place. You want to make sure your staff is properly trained, okay? And, as you saw the example of the behavioral health group, just because we sat in on a session doesn't mean that your staff member has legally agreed that they understand what you told them and that they're going to follow that. And there's lots of great examples of people where the employee said, hey, listen, yeah, you gave me a training, but I had to step out. There was a patient that called, so it wasn't my fault. Okay. Last thing, business associate management. We'll talk about I'm going to talk next about what are the requirements for that, as well as what is incident management. Okay, which means things happen at work. We all understand that, but there are some processes that the U.S. government expects you to follow to make sure that those things have a minimal impact. Okay, so let's talk about some of the misunderstandings we see. I don't know why my thing keeps jumping. Okay, so privacy rule is the rules around how you communicate with your patients. Okay? The security rule, on the other hand, is where a lot of people get into a little bit of trouble here. Okay? Because what the security rule said was not a security risk assessment. Okay? What it said is there's actually 6 required audits every year. 2 of them are security, directly related to security and technology. Okay, the rest are related to how to your physical site, to your administrative and your privacy processes. Okay, by the way, not to be confused with privacy rule. That's how you talk to your patients. The last area, which is really the omnibus rule, or otherwise known as the breach notification rule, really said two things. Anytime an incident occurs, you must investigate it. And once you've investigated, depending on the nature of the incident, if there was the potential for more than 500 people to be affected, you must report it to the federal government within 60 days. If it was less than 500 people affected, you still have to report it just at the end of the year. Okay, and a lot of people don't understand about that all incidences need to be investigated and reported upon. The business associate component of the omnibus rule said really two things. It's one of the reasons why HIPAA enforcement is up 400% right now, is because at the end of 2013, with a 2-year grace period, the law changed. And what it said is any vendor, those business associates we talked about earlier, must also be HIPAA compliant, just like a doctor's office, and that the nature of the relationship between the two of you, you must have what's called a business associate agreement, a legal document that outlines the relationship between the two of you, and you have to also do your technical due diligence, which means before you gave the information, before you hired that a technology provider, calendar application, IT person, lawyer, accountant, etc., you need to have some sort of proof that you check to make sure that they can protect the PHI that might be shared. By the way, you are not responsible for their HIPAA compliance, by the way. You're responsible for checking do they have the ability to protect the information you're sharing. Only the U.S. government is responsible for whether or not they're HIPAA compliant. So, causes of HIPAA audits. A lot of people are confused about this. There are really 5 main paths of a HIPAA audit. One is a breach. You have a breach, you have to notify the U.S. government, you will get audited. Okay, by the way, please don't presume that how are they going to find out, don't do it. Most of the auditors, and we work with a lot of auditors, any given month I'm involved with 2 or 3 different audits across the U.S. Don't try to hide it. You had a breach, tell them about it, say you're working trying to figure it out. They will treat you much nicer than if you tried to cover it up. Okay. The second thing that happens is a business associate, one of your vendors, caused the breach. Therefore, you are getting audited because one of your vendors got audited or failed an audit. Therefore, there is considered a vulnerability. Okay. By the way, about 30% of all breaches are actually caused by the vendor, not by the client. What's called phase 2 random audits. In some of the changes in the way the law was enforced over the last couple of years, the government now does just true random audits. They reach into a hat. It's a little more sophisticated than a hat, but they pull your name out. They will send you a document asking for information, and if you provide the documentation well, you're off the hook. If you don't, you have a problem. Meaningful use MACRA MIPS failures. Okay. CMS is the governing body of what is MACRA MIPS. It is an incentive program, folks, about quality of care. But the reason why it asks for a security risk assessment is because they assumed you were HIPAA compliant. That slide I showed you before. The law always required it. Now, if you fail there's 5% mandatory audits of MACRA MIPS. If you fail that, or the auditor believes you are not HIPAA compliant based on the information you shared, they report you to OCR. Okay. The last one is reported whistleblower complaints. There's a couple different categories here. By the way, I do not have to be a patient nor an employee of yours. If I walked by and I noticed as I looked through the window, I saw something that I considered a HIPAA violation, I have every legal right to report it to OCR, Office of Civil Rights. Those are the people who investigate it. Items that are reported to them are mandated under congressional laws or rules. It must be investigated. It cannot be ignored. Okay. The other real kicker here is if it is considered fraud, waste, and abuse, i.e. there was money that was, let's say, inappropriately taken by your organization, the person who reported it is entitled to a finder's fee for having reported it. Okay. So there's actual incentive for people, if they see you doing something, to actually report it. Okay. Now, by the way, folks, you are welcome to post questions on that right-hand side. I probably, a lot of material I want to cover, so I'll probably answer them at the end. But if there's a slide that you see something like, hey, please don't, feel free, write the questions in. I will do my best to answer them all before we get off. Okay. Business associate agreements. Understand a lot of people make this mistake. I go to a lot of, let's say, cocktail parties or backyard barbecues, and people presume, I don't really have to deal with this. Understand, if you have a minor situation, like, for example, this is Raleigh Orthopedic, okay, what all they were trying to do was get x-rays recycled. Okay. The problem was they gave them to a firm to recycle them and did not do a business associate agreement. Okay, so they didn't have an agreement that said, hey, I'm giving you a bunch of stuff, and I just want to make sure you're going to protect the information that's on that stuff. Because of that, and someone reported them, it was a $750,000 fine and a corrective action plan. Okay, one of the things as I start going through the fines here today, by the way, only about 10% of the actual cost of is the fine. 90% of the cost to an organization is actually the things that happen below the line. Okay, you know, bad reputation in your market, loss of business. Okay, they can modify your banking relationships, your insurance relationships. Often, because you have to notify the patients involved, it ends up in the cost is about $250 per patient you have to notify, and then two, what you usually see, and I don't know if we have any lawyers on the call here today, understand that usually results in what's called a class action lawsuit, which means a lawyer hears about this. There were, 17,000 people affected. So what happens, they contact the 17,000 people and say, listen, all you got to do is sign this piece of paper. We're going to sue the organization on your behalf. Okay. So you really want to be doing these things right. And the point that hopefully when we get through all this is not to scare you. It's that it's actually relatively, I'm not going to say it's easy, but it is not that, it's not hard, it's not expensive, it'll help you run your business better if you take the time to be HIPAA compliant. Okay, another small mistake, this was actually caused by the business associate. Filefax was providing services, document storage services predominantly, and disposal for organizations. They got into a little bit of a jam. Ended up being that the client in this case did not have a BA with them, therefore they were sued. Therefore they were fined for $31,000. The real issue here that's kind of scary, because of this investigation and the ultimate fines to Filefax filed for bankruptcy. They shut down. Okay, so that happens, and please don't. We do not want to see that happen to any organizations. Now, in regards to your business associates, many of you will say, "I don't have to worry about this, Mark, because I have a fantastic vendor that I work with." That's awesome. Okay, but more than half of the vendors you're talking to are reporting massive security breaches. Many times, multiple ones in the last 2 years. Things like ransomware. 88% of ransomware is targeted at healthcare, small, mid-sized organizations. And often, it is not uncommon for them to be hit 4 or 5 times in a day. Okay, and even the most sophisticated technology firms that I work with are not necessarily equipped to handle that kind of attack, if you want to call it. Okay. If you think of the breaches that we see, there's something called the Wall of Shame, HHS Wall of Shame. And what that says is, by the way, any public record breach, it can be looked up. Okay. When you look it up, you can look it up by zip code. You can look it up by type of business. You can look it up when it happened. It is not only all breaches and incidences, but it's also in the past 24 months, open investigations. So, for example, there are currently 13 eye care investigations that are open right now by the U.S. government. I've actually put this slide up before and had people in the room go, "Oh Lord!" Okay, they had just acquired that practice. Okay, that's a true story. All right. So, the one of the things that I want to stress when we look at this, okay. 59% of the issues were caused by simple loss or theft, which means you could have had the most diligent technology efforts on your plate, but if somebody, by the way, the statistics say 1 in 10 people will lose a smart device a year. So if you have more than 10 people on your staff, I can guarantee you one of them will lose a device, will be potentially a meaningful breach, which means you will have an investigation. So the belief that this won't happen to me is a very risky proposition. Right now, across the entire healthcare market in the U.S., I think the chances of you being audited are about 1 in about 3 to 400. Okay, so there's a much better chance of you getting audited than, for example, getting struck by lightning, eaten by a shark, winning lotto, getting a hole in one. So, okay, breach notifications. Often I hear people say, "Well, no one's going to know about it. We lost a device, the laptop. It's okay. We got the virus off it. Everything's fine. Okay, we paid the ransomware." The problem is, as many of us in life know, a secret, at some point comes out. Okay. And for example, in this particular case, which was President's Health, all they lost was the surgical records. Okay. It was the schedule for the day that was lost. Okay. Or the week. All right. It was not deep into their files. It was just the schedule of the surgeries for that week was somehow got misplaced. Ultimately, it was found. Unfortunately, it was found by somebody outside the organization and then reported. Okay. $475,000 fine for not reporting it. Now, by the way, I'm going to stress again, the U.S. government and the auditors are not out to get you. In general, healthcare, we've done a really poor job of protecting the information we have. Okay, if you look at the massive breaches, Anthem, Blue Cross, we are talking 1 in 4 Americans had their information accessed. Okay, and we're told by, in this case, Anthem, Blue Cross, that they are going to get free credit reporting for 2 years because of that. By the way, that's the law mandates that. It wasn't. Anthem didn't do it to be nice. Okay, now let's start moving in the positive direction of the things that you can do and how compliance can be simple. Okay, so the way an auditor comes to your comes to your location, they don't show up with badges, and there's not like some FBI SWAT team that breaks down your door. Okay, what you get is a notification, a certified letter. By the way, they will never call you. If you ever get an organization calling you, saying that they are an auditor and that you must go through this over the phone, that is a fraudulent. There are a couple of firms that we see in the market that are doing that kind of unethical practice. The government wants to audit you, you will get a certified letter. You will have 10 days to supply the documentation back. Okay, now, what are they looking for? Okay, we talked about that I said about the 6 audits and the policies and procedures, but because HIPAA is a gray law, we mean by a gray law, it has to work for everything from a standalone single doctor practice to the largest hospitals and some of the largest healthcare technology firms. So what they did is the government came up with a guidance. Okay, so this is the guidance for both HHS, Health and Human Services, HIPAA, and the OIG, the Office of Inspector General. These are where auditors are born. Okay, and when they come to your location, what they're going to look for is the 7 fundamental elements of an effective, notice I say effective compliance program. Okay, what's effective for my organization as a technology firm could be very different than what's effective for your organization as a surgical center, okay, or a multi-site surgical center. Multi-specialty center, who knows? Okay, so the way this works is everything's got to be in writing. Okay, so saying we had a staff meeting and talked about it doesn't work to the U.S. government. 2, somebody in the organization has to be deemed responsible for keeping an eye on these things. Okay, so who's responsible for making sure that if there is a patient that comes in or an employee is doing something wrong, there is someone at the organization who can raise their hand and go, let's say, outside of our operational structure, i.e., they may have to report their boss, okay, that something bad is going on. Effective training, lines of communication, and monitoring and auditing are probably the 3 that get people in a lot of trouble, okay? That example of that training for the Alaska Behavioral Health would have sounded like it was good, except that they had such high turnover, it was not effective, okay? So auditors look to see, are you doing the right things to protect the organization, okay? Disciplinary guidelines. It has to be very clear. The government does not like, well, I didn't know. Okay? They want to know that you've explained to your staff, if you do something wrong, you could be suspended or lose your job. And by the way, that's everything from a senior, whether it can be actually the owner of a practice, okay, or the CEO of a large organization. If they break the law or the guidelines, there's repercussions for it. Okay. The last is responding promptly to detected offenses. That's that breach notification rule. Okay. Investigate it, report it appropriately as you find it. So, a couple other real world examples, patient testimonials. Physical therapy organization, especially those that are, think of your organizations, you're advertising, trying to get people to come in for surgical procedures, let's say LASIK. You have a testimonial. Patient gives it to you. They write a nice letter to you. Sounds nice. Let's put that up on the website. Problem is, Patient didn't say you can put it up on the website. They wrote you a letter that said that they, gave to you personally. So if you don't ask them for in your use and disclosure documents or a specific document saying thank you for sharing that testimonial, can we put it up on our website? You're breaking the rules. Okay, and then that's this particular case was $25,000 fine. Kind of an unfortunate one. This was an organization out of Texas. They'd put out a press release. They were very proud of themselves and that they had stopped a fraudulent claim. Okay, there was a patient who came in and whatever she had done, they had caught her that it was a fraudulent claim. The problem is they put her name and the procedure that was done, it really was a procedure done, in the press release. They did not have her permission to share PHI. So unfortunately, it was a $2.4 million fine against that organization. Breach notifications, hey, if you don't report within those 60 days of when you find out about it, by the way, it doesn't matter when it happened, it's when you first found out about it, you're looking at fines. Okay, things like unencrypted devices. This was actually, it was an organization that lost a laptop. The issue was not that the laptop was encrypted or not encrypted. Matter of fact, I can talk lots of stories about ones that were truly lost unencrypted laptops, but still no fine. In this particular case, the reason they were fined was for the reason that their response was they had done 6 security risk assessments, one every year. By the way, HIPAA law says you got to keep your documentation 6 years back. Okay, so they had said, look, every year we do our security risk assessment. We had a HIPAA compliant EHR, we had a HIPAA compliant hosting service, etc. Government said, awesome, except if you had truly done the administrative and privacy audits that are required, you would have had a policy or procedure in place that said employees are not allowed to take company equipment on vacation, and they're especially not allowed to let a child watch Netflix by the pool on a device that has sensitive information on it, and that's what happened. Okay, so their fine was considered negligence because of that. Malware, there are so many different malware ones I can talk about. These are ransomware in today's world. It's a very prolific problem. The problem is in each particular case, and what you see if you look at all of these, it is always 3 reasons why people get audited. Okay, 1, incomplete risk assessments. 2, you did your risk assessments, but you didn't have the appropriate policies, procedures, and training in place to protect it. Or lastly, you did not have a business associate agreement in place before you shared information. Hey, Bill, did you have a comment? Did you want to jump on something?
No, I'm sorry. Go ahead. You're good.
No, I just heard you on mute. That's all. Okay. So the puzzle. Okay, and listen. Obviously, there are many ways to be HIPAA compliant. Okay, you can use internal tools, external tools. You can do it yourself. Okay, this was a federal law. Hey, Bill, can I ask you to mute for a second? There's a weird feedback we're getting off of you.
Sure.
Okay, thanks. Okay, so step 1, you got to do the 6 required audits. You got to do them every year. Okay. Number 2, when you are done doing those audits, you have to identify your gaps. And you have to have definitive documented remediation plans. I can tell you stories about a doctor's office, a medical. They had about 30 facilities. They lost an unencrypted laptop. They were not fined or had got any corrective active plan. Why? Because they had identified their gaps and they were in the process of updating all of their equipment. But they can only do so many locations at a time. There's only so much time and money in any budget. So the fact that this laptop was stolen at location 27 and they had done 22 locations, the government said, yeah, you made an absolutely good faith effort. We understand. Now, by the way, I'll talk about good faith effort. What the government wants to hear, those 7 fundamental elements, what they want to hear is that you made a good faith effort. The U.S. government is not bulletproof. Okay, Equifax, one of the big 3 credit reporting bureaus gets hacked. Okay, they understand that no one's perfect, but they want to see you did everything you could to limit that challenge. Okay, so you have to identify your gaps. You have remediation plans in writing. Okay, now policies, procedures, and training. About 80% will be policies, procedures, and training. So do you have policies? Do they accurately reflect your business? Do you review them every year and make sure that they are up to date? Okay, which brings to the next thing. Does each one of your employees, have they fully agreed regularly, i.e. every year, have they legally attested that they understand what you've asked from them, and they've legally agreed to follow the rules? Okay, and an example I'll give here is another organization that I've worked with. They get a nurse who accessed her boyfriend's mother's medical records. Okay, mom, the mom wouldn't tell the son what she was going in for. Son asks girlfriend. Sure enough, age-old story. Okay, when the mother sued and reported this as a massive HIPAA violation, this was a really big deal. This was going to be a multi-million-dollar lawsuit plus multi-million-dollar negligence fine. But because this organization was able to say, look, I agree, we've done all our assessments, we do policies, procedures, and we can prove that that nurse on this day at a specific time legally agreed. She attested in a legal form that she understood that policy and that she was going to follow it. And that's what got them. The OCR auditor dismissed the claim, as well as so did the federal judge, or the judge in this case, and said this is not a HIPAA violation or nor negligence on the part of the business. And those are the kind of things that you want to think about, right? That's not a big expense, right? If you can do a staff meeting, don't just have a big sign-in sheet. Right? Have something specific, name on top, on this date, this time, I agree, I understood, and I agreed to follow these orders. Okay? Business associate management. BA management really requires two things in today's world. The contract. Okay? A business associate agreement is a legal agreement that says three things. Okay? One, you both understand that you fall under federal HIPAA law. Okay? By the way, a BA agreement does not increase your liability, it lowers your liability. Why? Because that statement I just made. We've agreed that we both understand HIPAA is a law and we're both going to follow it. Okay? One of the ways we're going to follow, the other two parts is, I am responsible for what I did, you are responsible for what you do. Okay? So if you have a vendor who makes a mistake, you're not responsible for what that vendor did. You are responsible for what you did. Now, there could be some intersection points where, hey, but that's why you want that line in the sand. Other things about a BA agreement is the next thing is what's called technical due diligence. You have to have some proof that before you gave these people access or you shared information, it was listen, it's okay if you want your nephew to do your billing for you out of their basement, okay? But your nephew is going to have to be able to prove that there is some ways that he or she is protecting that information in that basement. Okay, locks on doors, file cabinets, etc. Last thing is the incident management. Got to investigate everything. Meaningful breach, 500 or more, reported within 60 days. A non-meaningful breach reported at the end of the year. Okay, so Bill, I would say folks start sending us questions, and then Bill, I think you wanted to jump in and talk a little bit about some things.
Yeah, thanks, Mark. Just a couple things for everybody that's listening in. Again, I know this can be a little bit overwhelming. We've got a variety of people on the phone today, doctors and staff members, administrators as well. You're busy people, and we know that you're busy people. You've got a lot going on. This seems to be something else that's just piling in on top of all of the other things you have to do, as well as taking good care of patients. So what we've tried to do in summary is to take our organizations, my organizations, Mark's organization, and take the software that he offers and begin to put that together for you in a concise method, which allows you to manage all the different pieces of the compliancy puzzle. Because we know that can be overwhelming. What we are providing is really all you'll need to do. I mean, you'll still have to do a lot of work, but we can coach and walk you through this. It's one repository of all the information, one place that all your documentation can be held. And should something happen, we hope it doesn't, but should something happen, then you've got one place to go to get all the information. You're not doing it, in a manual over here or a manual over there or a file over here, or trying to find the information. And we have people that are experienced and do this for practices and all over the country. So I would encourage you to take advantage of what we have. We've got a lot of information that we're willing to share with you guys. Again, there's a lot of good stuff that we've learned, Mark's organization have learned over the years, that we'd be happy to share with you. All you need to do is to reach out to us. We can get you that information, and then you can decide, is this something I want to take on myself, or do I need somebody to help and coach along the way? And again, one of the things that we've seen in our practices, and Mark alluded to, is this whole cybersecurity issue. And for our practices around the country, we've had a really tough time acquiring cybersecurity insurance without being HIPAA compliant. So that may be, you all may be experiencing that as well. And again, this may help you get to a point where you can obtain that cybersecurity insurance that you need. Again, I want to especially thank Dr. Karen Perry for putting this on, along with CompuLink and Link Wilson and crew, because hopefully you'll find this helpful. And again, if nothing else, reach out to us, and we'll be happy to share key information that will help you, whether you decide to do it yourself or however you become HIPAA compliant. Mark?
Great. All right. So let me start answering some of the questions you guys posed. And please, like I said, as I'm going through this, throw me lots of more. It's kind of the fun. Let's see if we can stump the auditor today. Okay. So one is, the very first one was, we have a very small office, one psychologist and an office manager. We have CompuLink, congratulations, and only file claims through them. We do not keep medical records online. How safe are we? Okay, so hopefully part of what you picked up as I was going through this, it's not necessarily a matter of how safe you are. It's anybody can have a malware attack. Okay, anybody, and there's other webinars we can do for you about, truly how cybersecurity and ransomware happens. The issue here is from what is the HIPAA law, it's your ability to prove your good faith effort. Okay, it's not whether or not you're online, offline. It's have you looked at your organization across the 6 areas of risk? Have you addressed them? Have you looked at yourself? Have you then therefore said, okay, great. I know for example, especially common in smaller offices, tighter footprint, depending on where you are. Do you have a file cabinet in a hallway? Okay. Do you realize a patient could step out of a meeting to go to the restroom and open a file cabinet and have access to PHI, and that would be considered obviously very negligent on your part. But you could fix that pretty easily by putting that file cabinet in an office, okay, or in a supervised area is the legal term you would hear from HIPAA, or you put a lock on it. Right, and that basically it's always under lock and key, and there's a policy or procedure that your staff has agreed to, large or small, that they are not going to leave that file cabinet unlocked at any time. Okay, so those are the kind of things. It's not a matter of the safe question is a little bit of a misnomer. Actually, one of the things that there's an organization called CompTIA, which is the international certifying body of all security technicians, and they cite the number one problem today in security is this belief that most people have in what they have in place is good enough. Okay, where often it is not, or it is weak in areas that could have easily been shored up. Okay. One question real quick was someone asked about the PowerPoint. We are recording this. I will leave it to MCG and CompuLink to figure out how to share this with you folks, but there's definitely a whole bunch of resources that we have available for you, and our pleasure to share them. Okay.
Hey, Mark.
Please.
Mark, let me jump in back on your other question too. I want to make sure that everybody knows we have a list of items that you can go through to help make you again HIPAA compliant, and we're happy to share that compliant list with anybody who's interested if they just reach out to us. So I'm sorry, go ahead.
No, on that checklist, by the way, Bill, it's a great way to you just to look at yourself. It's 10, 11 questions. If you're feeling good about with the questions and the answers you have for it, you're in great shape. If you have if you're concerned, obviously, we're all of us are here to help you. Okay. If electronic training modules are done, is an electronic signature enough to have on hand? Absolutely. Okay. The issue here is the government just wants you to be able to support that you made a good faith effort. Okay. So electronic or physical. What doesn't work real well is we had a staff training and they just was a sign-in sheet. Okay. Because the only thing that anyone's attesting to that is that they signed a piece of paper that doesn't tie to any specific thing. Okay. Do we still need to report malware if none of our PHI was taken or affected? Okay, this is a really good question and is very related to what ransomware is, okay? Now, in the end, without going really techie on you guys, if you have a meaningful breach, okay, i.e. a malware attack, whatever it may be, and you paid the money and you supposedly got your data back, you really don't know what happened, okay? So you have a breach. You have an incident, does need to be reported. Except, okay, if you were truly HIPAA compliant and you had done all the things that are required under the law, you would have been encrypted and you would have had your data backed up, which means that without getting, like I said, techie, it would have meant that when you got the ransomware attack, you would have been able to say, you know what, I'm not paying you. Why? Because whatever you just stole, you don't have the key to open it, which means that information is gibberish. Okay, so you can't use it, and you're right. Right now you've locked up my computer. I can't use it either, but I have a backup, and my backup is not been attacked by ransomware, so I can wipe my drive and I can bring up that backup, and now my patient's information was never corrupted, and it was and my ability to serve that patient was not affected. Okay, so there are scenarios where you can absolutely have a ton of ransomware attacks, and you have no obligation to report, but only if you have proper encryption and proper backup in place. Because, and by the way, folks, you know, have an iCloud or Dropbox is not necessarily proper encryption nor backup. Okay, there are some very more advanced requirements, and as you saw by the you know, relying on your vendor to do this for you, although you know, is a viable option. You just need to make sure and be cognizant that 30% of the vendors who are doing this are having massive breaches or incidences on their side as well. Okay. Okay, I am starting an optical goods business. We do not have a doctor right now. What do I need to do to be HIPAA compliant? What forms do I need? What written procedures and policies do I need in place? Okay, so pretty much I would say we'll get you the checklist. What you saw me present, it does not matter if you are a solo practitioner working by yourself in an office off the side of your home, or a 10 location surgical center. The law is the law. It expects you to have those 7 fundamental elements. It expects you to do that wheel that you saw me go through to be in place. Obviously, the larger, more sophisticated you are, the more complex that gets. But I would start off with, we'll make sure that you get that checklist, because that'll be a great way to help you make sure that we do answers for you. Okay. Lots of questions about the checklist and the recording. What I will say is at the end of this webinar, okay, you're going to get asked like a survey question. Hey, what'd you think about this? And would you like more information? Just check off yes. And Bill and his team will make sure that we get the checklist over to you, links to the webinar, etc. So on the person who talked about their malware, they said they did not pay for the ransom. We just lost the documents. Hey, listen, technically, as painful as that might have been for you, okay, so let me rephrase the question. Often in the world of cybersecurity, the debate about ransomware and should you pay it, okay, comes up. Okay, we in the world of trying to stop this from happening would say don't pay it. Okay, first of all, just because you paid it doesn't mean they're not going to come back. Okay, and even we've seen some clever ransomware attacks that say we'll give you your data back if you send this email to 2 of your friends. Okay, which is really, really, really sinister. So you did the right thing by not giving them the ransomware. It is unfortunate that you lost the documents. The answer would be is good encryption and backup would have been, you would have not have lost that data. It would not have been, because it was encrypted, would not have been a breach. And then lastly, about 60% of the people don't ever get their data recovered correctly. Okay, and there's even nastier statistics that often it's like 30 or 40% of the time people go out of business because they were unable to ultimately recover the information that they lost. And think about it: if you truly lost all of your information about your patients or about your business, could you be, tomorrow morning, could you function? Okay, so you do really want to do, you want to be smart about these things. 1 or 2 questions that I did not get asked, but I'm going to throw out there. If you get a vendor who does not want to sign a BA agreement or do your technical due diligence, run away. Okay? There are so many organizations in the United States that understand the importance of this, that are committed to protecting the patient's information that we all work with, that if you have a vendor who is not willing to do so, what they're telling you is that they know they are at risk, that they do not have the proper protections in place. And my counsel would be to you that is a bad business, that's a bad partner to work with. Okay. If it's a misunderstanding, sometimes people don't understand all the rules. That's one thing. But if you have an organization that point blank does not want to sign your business associate agreement or your or supply the required technical due diligence information, go find another vendor. Do not continue working with them. Okay. If there are no other questions, we on behalf of all of us, thank you so much for giving us an hour of your time. Hopefully you found it useful and educational. And obviously, our pleasure to support you in any way that we can. Bill, I don't know if you have any closing remarks.
No, thanks, Mark. Great job. Again, thanks to CompuLink. And I hope everybody enjoyed it. If we can help, please feel free to reach out to us. And best of luck to everyone. Thanks for your time.
Great. And like I said, folks, when you get that questionnaire at the end, please say yes, and we'll gladly get all that stuff to you. All right, everybody, have an awesome day. I appreciate your time.